This presentation is on the human papillomavirus vaccine, and the group members are Danielle, Islas, Madison, McCreath, and Leyleh, Salem.
What is human papillomavirus? HPV is the most common sexually transmitted virus in the United States. There are more than 100 different types of HPV, and at least 14 of them are linked to cancer. There are 14 million new cases of HPV every year, but it is preventable by receiving a vaccine.
What is a vaccine? There are many types of dangerous diseases, and without having immunity, our bodies would not be capable to fight them off. Immunity is our body's way of keeping us safe from diseases by not letting us become infected when we are exposed. When we receive a vaccine for a certain disease, we are helping to give our bodies a boost of immunity to fight that disease off before coming into contact with it. Once we have received the vaccine of a particular disease, our bodies are now immune to and presumed safe from that disease. Vaccines keep not only us safe, but they also keep those around us safe. Vaccines are typically received through an injection, but some can also be given through the mouth or nose.
The HPV vaccine is made from tiny proteins that look like the outside of the real human papillomavirus, called virus-like particles or VLPs. They don't contain any live virus or even code virus, so it will not cause cancer or any other HPV-related illnesses. These types of vaccines are known as subunit vaccines, and they're very safe and extremely effective. The HPV vaccine is given by injection in the upper arm. So how does the HPV vaccine work? When the vaccine is given, our bodies will make antibodies in response to those VLPs in order to destroy them. Antibodies are proteins that are formed by our immune system that recognize and get rid of germs like HPV. Once those antibodies are made, they will stay in our bodies in case we come in contact with that germ again. If we do come in contact with that germ, our body will already know how to fight it off, and it'll keep us from getting sick.
There's currently 2 vaccines against HPV on the market. The first is called Gardasil 9, and it's given to males and females between the ages of 9 and 45. Individuals 9 to 14 will receive 2 to 3 doses, and the number of doses is dependent on the schedule that the healthcare provider sets for the specific patient. Individuals 15 to 45 will receive 3 doses. Gardasil 9 is named so because it can defend against 9 types of HPV, which are types 6, 11, 16, 18, 31, 33, 45, 52, and 58. The previous version of this vaccine only protected against 4 types. The second vaccine is called Cervarix, and it's approved for females aged 9 to 25 years of age. It consists of 3 doses, and it only protects against HPV types 16 and 18. Of the previously mentioned HPV types, 16, 18, 31, 33, 45, 52, and 58 are considered high risk. Types 16 and 18 are associated with HPV-related cancers. And HPV type 6 and 11 cause genital warts and recurrent respiratory papillomatosis.
How the HPV vaccine affects society for women. 85% of people will become infected with HPV in their lifetime, and while most infections go away on their own, some infections linger and potentially turn into a deadly cancer. However, vaccinations have dropped the cervical rates in teenage girls by 88%, and it has dropped cancerous HPV infections by 81% in adult women. How the HPV vaccine affects our world for men. Often people think the only cancer HPV causes is cervical, thus only affecting women. However, cervical cancer isn't the only cancer caused by HPV, so it is important to understand how the vaccine also helps boys and men. HPV can also cause penile, anal, and or pharyngeal cancers, which is the cancer of the back of the throat, and all can be dangerous to males. There are thought to be over 36,000 various cancer cases in the US caused by HPV affecting both male and female. Of the 36,500 cases, the HPV vaccine can prevent 33,700 of them by preventing the infection itself. Thus, it is equally as important for males to get vaccinated at the appropriate ages as it is for females, so we can stop these diseases before they turn into cancer. Since it is critical that the first dose of HPV vaccine be administered in adolescents, the responsibility of vaccination lies with the parents of the patient. However, many parents feel uncomfortable discussing HPV with their child since it is a sexually transmitted disease. Because of this, it is crucial for healthcare providers to educate the parents on the importance of vaccinating their children from this virus and its potentially deadly outcomes. Aside from treating the virus itself, it is the healthcare provider's job to provide education to the patients. Studies show that without a healthcare provider's serious recommendation, only 35% of children were vaccinated for HPV. However, with their recommendation, 65% of children became vaccinated. Without the interference and guidance of our healthcare professionals, parents will remain uneducated about the vaccine, their children will remain unvaccinated, and ultimately more people will become infected.
So to sum it up, human papillomavirus, also known as HPV, is a sexually transmitted disease. It can cause genital warts or even cancer. There are vaccines currently available to prevent this disease. The vaccines do not contain any live or killed virus, thus they will not infect you with the disease or give you cancer. If you are between the ages of 9 and 45 or have a child in that age range, you should consider speaking with your healthcare provider as to whether this vaccine is right for you or your child.
All right, so test your knowledge. What's the youngest age someone can receive the HPV vaccine? Right, the answer is 9. Dose number 1 of the HPV vaccine can be given as early as 9 years old. Early protection works best. It protects our children long before they ever have contact with the virus. See cdc.gov/HPV for more info.
These are our references. Thank you.